Hello dentists, how are you today? I hope you're fine. Today we're going to talk about extraction of upper anterior and upper anterior teeth and lower anterior teeth. And also we're going to talk about the forceps used for extraction of each and how extraction takes place, and the dentist and patient position for extraction of upper and lower teeth. This is really a common mistake, especially to those who are newly graduate, and it's very important to know which forceps which forceps used for each teeth. So you have to know exactly the forceps required for each teeth. So let's start now. We're going to start with the upper anterior teeth. This is an upper anterior forceps used for extracting upper incisors and canines. Peaks are symmetrical and are placed in the same line with the handle as the handle. Peaks are concave and not pointed. Peaks are shorter than the handle, so that the load arm is shorter. Here, the load arm is shorter than the working arm. This is the working arm. So here we have, this is used for upper anterior incisors and canines. Let's go to the next one, which is the premolar. Okay, upper premolar. Here there is a little slight difference. Okay, it's a little bit concave. Okay, or the slight angulation. This is used for removing of premolar teeth. Peaks are symmetrical, concave, not pointed. Forceps have slightly curved shape and looks like an S. Okay, it looks like an S. Holding the forceps in the hand, the concave part of the curved handle faces the palm, while the concave part of the peak is turned upwards. Okay, this is how you hold it. So here, in case of anterior and premolars, there is no right and left for them, so it's only one forceps. Okay, forceps. For anteriors, we extract incisors and canines. Premolars are used for extraction of two premolars, which is 4 and 5. The last forceps for extraction here, we have here for molars. The last tooth here, we have it for molars. We have this type of forceps, which is the molar forceps, and there is right and left. So this is for the left side, upper left molars, and this is for the upper right molars. Okay. Here also we have can you see this? This is used for here, this side buccally, and this is lingual, the palatal. Buccal and palatal. Here, buccal and this palatal. So binet is this is used for the extraction of remaining root or broken roots. Okay, extraction of remaining root. We call it a binet. Okay, so these are the main types of forceps used for extraction of upper teeth. Here for lower teeth, let's see. This is used for extraction of lower anterior teeth, and this one for premolar, and this one for molars. Can you see here? In case of anterior, can you see the peaks are there's no space here. Okay. And there's angulation, of course. Okay. And this is used for central incisors and canines. This is used for 4 and 5, and this is used for 6, 7, and 8. Okay, can you see? This is for the molars. It's the peaks have they are here. The peaks are at right angle to the handle. Peaks are symmetrically pointed, and sharp pointed tips engage the bifurcation. Can you see here? It's sharp pointed tips engage the bifurcation at the buccal and the lingual surfaces. beaks are more broader and stout. Okay, so this is in case of lower molar forceps. Okay, lower molar forceps, we don't have right and left. Okay, only in upper we have right and left. But in case of lower, it's only one type of forceps for both right and left. Okay, so we have, again, this is for anterior teeth, this is for premolars, and this is for molars. So the lower anterior forceps have identical short closed beaks. Okay, the beaks are narrower than the lower molar forceps. This is narrow, of course, than the molar. Okay, short closed beaks. They are similar to the upper, but they are at right angles to the handle, and they can also be used as lower root forceps. They can also be used for removal of remaining root for lower teeth. Extraction of lower anterior teeth. Can you see? It's very important to look at this picture. You hold the forceps very well and get a good support to the jawbone. Hold with the other teeth with the other hand. So with the one hand you support, okay, holding the jawbone, and the other hand holding the forceps, and you start putting the forceps slowly until you reach the roots. Okay, until you have a good grip reaching the roots. Okay, then you start when you hold the forceps tightly to the root, you start rotating, slight rotation, to cut the periodontal ligaments. Okay, to make slight laxation of the tooth, and then start making buccal, moving buccal side, and then lingual, buccal, and then lingual, buccal, and then lingual, until you feel that the tooth has become loose, and then you try to pull the tooth upwards. Okay, this is how to extract lower anterior. This is in case of canine here. Extraction of lower anterior teeth. Here we have an upper. This is the lower and this is the upper. Okay, again, as we said before, we said that you hold you make a good grip, okay, of the force.